Now that we understand why we care about data and how to use it, let's take a closer look at that third source of data, our objective data, and where we get it from. In Texas, we get health-related data from three sources. Our largest source of data is required health reporting. Required health reporting is the foundation of our surveillance system. We supplement this data with data from our programs and insurance reporting. Let's take a closer look at each of these sources of data. First, we have required health reporting. Texas medical providers and laboratories are both required to report lab results that could indicate HIV. This includes reactive or positive antibody tests, CD4 tests, and viral load tests. This means that every time a person's lab results could indicate HIV, that information, along with some basic demographic information, is required to be reported to local health authorities and ultimately to the Texas Department of State Health Services. This electronic lab reporting is one of our largest and most robust data sources and provides us with the most information about people living with HIV in the state. Then, we supplement this required electronic lab reporting with programmatic data. Along with providing us with health outcome data, programmatic data is also often used to confirm race, ethnicity, and gender identity. The primary Department of State Health Services program we collect data from is the Ryan White program, including the Texas HIV Medication Program. We also use data collected through the Medical Monitoring Project, or MMP. The MMP is a CDC-funded comprehensive survey of people living with HIV. In Texas, there is a statewide MMP, and Houston has a directly funded MMP. Finally, we look at public and private insurance data. The Texas Department of State Health Services HIV STD program has agreements with the largest insurance providers in the state. We have a sharing agreement with Medicaid, and annually, we receive data from that program about all HIV-related claims, including provider visits, lab work, and prescriptions. We also have agreements with the largest private insurers in the state and receive all HIV-related services paid for by these insurance companies. All of this data comes into the surveillance department here at the Texas Department of State Health Services. There are three key data points that we monitor to help us understand what HIV health outcomes look like. First, we collect information on anyone who has had an HIV-related lab test, including reactive positive antibody tests, CD4 tests, or viral load tests. We get this from required health reporting, programmatic data reporting, and insurance reporting. Second, we collect information on anyone who has had an HIV-related medical appointment. We get this from programmatic data reporting and insurance reporting. Finally, we collect information on anyone who has an ART prescription. We get this from programmatic data reporting and insurance reporting. Our surveillance staff combine and deduplicates all of this data so that we can understand who is living with HIV, who has unmet need, and who is able to access HIV care and treatment. This information is the foundation of the Texas HIV Treatment Cascade, which we'll be exploring in another video. The HIV Treatment Cascade is a way to visualize the steps a person has to take, starting with diagnosis, in order to achieve viral suppression, the goal of HIV treatment. Based on the range of data sources that we have available, we feel confident that the data we're able to report out is accurate and reflective of what HIV looks like and how it impacts Texas communities. Now that we understand how we can use data, and we understand where Texas data comes from, let's go to our final video and look at some of the ways we analyze and report data.